Welcome to Dr. M Health Corner. How are you? It's Dr. Unati here, your host. Welcome. I am tuning in. It's it's just after 11 a.m. MST, and it's just after 1 p.m. Eastern Standard Time, after 7 p.m. in South Africa, CAT time. Hello, I see people are coming on. Hello. Uh, Please let me know if you can hear me. Please let me know if you can hear me. Thank you. I see people are coming on. How was your week? I hope it was wonderful. Mine was. It is a Saturday here. Today we're going to talk about something very close to my heart. I'm passionate about this. First of all, I need to give you my background. You probably wonder sometimes, who am I? What do I do? So today I'm going to share with you what I do daily. In my private practice, I know that I do this work with you guys, but I do every day. I go to work. I have a clinic where I see my patients every day, Monday to Friday. Okay. So today, thank you so much. Someone is tuning in from India. Wonderful. Thank you so much for joining us. So today I want to share with you what exactly I do. And as you can see, our topic is about health screening. Health screening, as a family physician, I'm a family doc. I'm a family physician for over 16 years. So what we do in our clinics, we basically take history, we diagnose, we basically come up with all these preventive measures that we're going to talk about today, and we treat, right? So that's basically what we do. And of course, we work with other specialists whom if you have cancer, I will refer you to an oncologist or a surgeon, whatever needs to be done, okay? So today I want us to talk about that. So basically, thank you so much for joining again. I am Unati, I'm Dr. Unati Makiwane, I'm South African Canadian, been here for over 10 years. The reason why I'm bringing this topic is because I'm seeing how things are done in this side of the world and how we can improve. Speaking for people from middle class and also low income countries, how do we improve our health? What have I learned in the last 10 years in this country, in this side of the world? That's basically what our discussion is about today, okay? So if you can, please take down notes. I would like you to take down your notes, because sometimes, it's not easy to come back and watch a show. There's so much that is going on here. Hi, Babalwa. So basically, yes, I would like you to take notes, because after this on Monday, I'd like you to pick up your phone, speak to your GP, speak to your nurse practitioner, speak to your nurse, because I would like to see a change in our countries, okay? So that's the whole point of this discussion today. Again, thanks for joining me. So what do we screen? The topic, as it says, why, how, and when do we screen, right? What age group? A lot of you guys, you ask all these questions. Today, you're going to leave this space knowing all of that. And hence I'm saying, take your notes, take down notes, because I want to see a difference in Africa. Where I live in Canada, lifespan here, average is 82 years, right? And actually probably 82 years for men, but women 84, 86, just around that. In South Africa, where I come from, is around 64. So basically we have this 20-year difference. What are they doing different, right? That's probably the question you're asking yourself. Why are they 20 years above us? We're all humans, we have blood, we have the same things, but why are these people living longer than us? I understand that even other countries in Africa, actually, I noticed that there's people that live even up to 40-something years, right? So that's very low. So now we need to look at our public health. Public health is basically everyone's right. You have a right to health, right? Your mental health is part of what we're going to talk about here. You have a right to physical health, right? Many countries, when women are pregnant, we see a lot of deaths, the death rates. And in this side of the world, they have so much preventive measures put in place to prevent that, all right? Of course, even in this side of the world, there's also layers, because in America, Black people are dying more than their counterparts. I'm not going to talk about that today. I don't want us to be political. But what I'm talking about is, what is the Western world doing better than Africa, Asia, South America? That's the whole point of our discussion, okay? So head to toe, take down your notes. So what am I looking for? When you come to my clinic, what am I going to discuss with you? What are we going to talk about? Head. Let's talk about it. So basically, when you reach 18 years, How interesting. When you reach 18 years, when your child is 18, every year, your son, your daughter needs to check blood pressure. Mhm. So I understand that pharmacists now, like I'll talk about South Africa because I'm South African. Clicks, I've seen that they check blood pressure. Drop in when you come in for that flu medication. Check your blood pressure once a year at least when you are 18 years and above. Okay, so from as early as 18 years, I'm saying this because when you have uncontrolled blood pressure, which is called hypertension, we saw it in the COVID times. Many people who died of COVID had unknown history of diabetes, of hypertension. So people were not screening. People didn't know. And unfortunately, COVID-19 hit a lot of people who had uncontrolled diabetes, uncontrolled hypertension, unknown status of HIV. All these people who had low immunities, they basically died compared to other people who were okay. And of course, there's other factors. So the reason why I'm mentioning hypertension, because head hypertension, when it's uncontrolled, it will cause stroke. Yes. So basically, it ruptures. When that blood pressure is very high, it will rupture your brain arteries. And hence, people have stroke, right? So that's number one. From age 18, start screening for high blood pressure. Check your blood pressure every year. Go to your pharmacy. And actually, many people with medical aid, they check with your medical aid and your doctor or your pharmacist. Your medical aid could pay for your blood pressure machine. So have it at home. I have it too. I'm a physician. I have it too. I have it in my clinic. So I check everybody in this house. So blood pressure, right? Two, mostly people, when they reach 40, things change, right? Your body changes. Hormones are starting to change, all these changes. So when you reach age 40, these are the important things that you need to check. Check your cholesterol, right? Cholesterol, when it's high, you have a higher risk of blocking your arteries in your heart, your arteries in your brain, and you get stroke or heart attacks. So check your cholesterol, okay? Check your diabetes screening. Screen for diabetes. Many people, when I was practicing in South Africa, many of our patients came because of symptoms. It changed when I came to this side of the world. Many of my patients, they don't even have symptoms because the system here is set according to you prevent before things happen. My stroke patients have lived 15, 20 years here because we control their blood pressure. We check their blood pressures, right? So check diabetes, screen for diabetes. As I'm still there, know your family history. Know your family history. Many of us, we don't know what our grandmothers, our grandfathers, our aunts, our uncles had or have. So it's your responsibility now going forward. Or, like I said, if you have an access to a blood pressure machine, check your aunt, check your mama, check your dad, check your uncle, right? Because these illnesses or these diseases have a genetic factor. If your mom has hypertension, you have a risk of developing that because of your genes. You didn't choose it, but because you are a family. All right. So screen for diabetes, right? We do a fasting test here. Okay. So you go to your doctor to screen for that or your nurse. Fortunately, in Africa, we utilize clinics run by nurses. So our professional nurses, our registered nurses, they know all that. So screen for diabetes. Okay, we mentioned diabetes, we mentioned blood pressure, we mentioned cholesterol. All right, man, yes, man. When you reach 50, when you reach 50 years, things change. Like women go through menopause by around 45, but mostly the average age is 52. Men, when they reach 50, sometimes even when they are 60, 70, their prostate gland, a little guy, right when we do finger examination, putting our fingers in your butt, I know that men hate this exam, but it saves lives. One of my professors, back when I was in training, he said, an examination without a finger exam, your anal examination, we call it direct rectal exam, is incomplete. Yes, it is incomplete. I always tell my patients. So you prepare your patient that I need to do this examination because I need to check your prostate gland. This little guy is the size of a walnut. What it does, it's part of your sexuality, it's part of your fertility, right? That's basically where also your urethra is passing by, right? And actually, that's why when it is enlarged, men, they keep going to the bathroom in the evening 4 or 5 times. They're waking up and the urine is dribbling because that little guy can enlarge. So by age 50, start looking for. There's a test we check. It's called PSA. Look for it. Your doctor can actually start screening. And of course, your finger examination anally. And of course, sometimes we start this examination earlier. Say you have a father who had prostate cancer, right? So this PSA level, it's called prostate specific antigen. It goes up in people who have cancer. It goes up with people who have enlargement. Okay, so this is when we work with our other colleagues, our urologists. They will look into it and see what's going on, right? That's what actually Nelson Mandela had prostate cancer, but it was caught early. That's not what killed him. He died of respiratory issues, but him, he got it. Archbishop Tutu had it, but this man, they have doctors who screen them on time, right? So you have such opportunity. You go to your hospital. As far as I know, our hospitals, there's free health. Yes, it might take time to get all these tests, but it is your responsibility. All right. If you are lucky, you are fortunate, you are blessed, you have medical aid, speak to your doctor. All right. Speak to your primary caregiver. Give him these lists I'm talking about. Check for it. Okay. So know your family history. We talked about that, right? One. Now, if you are a smoker, in this side of the world, we really check into that. We educate people to stop smoking. And actually, things have improved in the last 10 years. I mean, the last 5 years, there's less and less people who are smoking, which is great because lung cancer is a reality, guys. Lung cancer is a reality. And now studies even tell us that even smoking cannabis, marijuana has a risk of developing COPD, which is also a lung disease due to the smoke or the damage of your lungs due to the smoke or the nicotine and also other chemicals that come from smoking. So we do check either at least once a year, chest X-ray, or sometimes CT scan, depending on your risk. Again, depends on your story, depends on your country. You cannot probably just come and say, I need a CT scan. Again, these countries are different. I am in the first world country where all these things are done. People don't pay. But in our countries, in Africa, we have to also utilize and also manage resources. But what best action you can take is stop smoking, right? And also now we're starting to see secondary smokers. With what means when I say secondary smoke, your husband, your wife, your partner, your colleague who smokes in front of you, you are inhaling that. I have actually my older patients here, they would say, Doc, I've never smoked in my life, and they have COPD because they were exposed to the 20 years marriage with their spouse who smoked right in the house. So these are the things that you need to take care of. So you could be a secondary smoker without necessarily putting it on your mouth. So if your spouse, if your child, if your colleague smokes in front of you, you are smoking secondary. Just know that. All right. And you do run a risk of developing things like asthma, of COPD, of lung restrictive diseases, so many things that could happen to you because of smoking. All right. So stopping smoking, and there are medications to stop smoking. So talk to your doctor. I know that most countries will have or will carry these. Your pharmacists, you can talk to them. There are medications. Some people, they even go for things like acupuncture. And you also have to work on your mindset. Do you want to stop smoking? Why do you want to stop smoking? Maybe you have grandchildren to look forward to have, to play with, to run after, because you don't want to be carrying oxygen. I always tell my patients who love going on holidays, do you really want to go in summer? You want to go to Mexico carrying an oxygen and not going to the beach? They go, oh, exactly. So you want to have a reason to stop smoking, or you want to enjoy life. Life is beautiful, right? Many people, they cut their lives short because of their habits, right? So again, while I'm talking about smoking also has a risk to your arteries. We talked about stroke, We talked about heart attacks. We talked about lung diseases. Unfortunately, smoking also has been found to cause blockages in your legs, in those arteries, supplying blood supply to your legs. That's why sometimes we see people having to go for amputations. It's a whole lot of things. It could be due to uncontrolled diabetes. It could be due to the long-standing history of your smoking. You damage your arteries. Your arteries need oxygen to go to your brain, to your legs, to your heart, to your lungs, to your liver, all your organs. So it's a self-imposed pain when you do all these things. So now we even emphasize this because we're starting to see people as young as 15 smoking, right? I have a lot of people that tell me, Doc, I've been smoking since I was 10 and they're 80, right? So these issues are real, guys, okay? So smoking can cause that nicotine destroys all those layers of your arteries supplying your blood supply. All right. So again, while we are still talking about diabetes, diabetes has complications like cataracts. You start not seeing. If you're seeing that you are not seeing well, go see your doctor. Be referred to an eye specialist, or at least starting point, see an optometrist. See optometrists where you go for your glasses, they are able to diagnose cataracts so that this can be extracted. It is treatable, right? And usually when you have cataract, usually it's very common in people with diabetes, but we do see it in general population. Sometimes there's a family history. Some complications are glaucoma, where you have accumulation of eye pressure or fluid inside your eyes. So these are the things that happen when you have all these illnesses undiagnosed or uncontrolled. All right. So you need to check your eye testing once a year at least. Go see your optometrist. Please check my eyes, right? The optometrists, when they see these cataracts, when they see these glaucomas, they immediately send you back to me or send you to an ophthalmologist, the eye specialist, the eye surgeons, so that you get the help you need right away. All right. So that's very important. And then again, breast examination. Make it a habit. When you are in a shower or you are laying down, many of my patients, they have diagnosed themselves or found lumps with cancer because they do proper examination. Ask your physician to teach you how to do breast exam. But the key thing is, during the period when you have your periods, it's not really a reliable time because your breasts are engorged, the hormones are changing, so they might feel a little bigger, they might feel a little lumpy because of the hormones. So usually it's safer to do that after your period, maybe 10 days after your period. It's safer to examine your breasts, but go to your physician to examine, because now we basically send you to go for a mammogram. A mammogram as early as, in this side of the world, as early as 40 years. Know your history again. If you have an aunt, you have a mother, you have actually men too have breast cancer. It's a very small percentage, below 44%. So if there's any family history, some people, they wait, they do it either at 40, or if there's no family history at all, by age 45 or 50, start doing mammograms. Go check it. Yes, a lot of people say, Doc, it's painful, but would you rather screen than to be found late that you had breast cancer? Because breast cancer, it does spread to other parts of your body. Nowadays, we even starting to see young women as young as 35 with breast cancer. So make it a habit. Examine your breast every month. I know that we don't always get it all right all the time, including myself, but make it a habit. Examine your breast. Okay, so you do your mammograms. Mammograms, we do them either every 2 years or every year, depending on what the radiologist tell those radiologists. They usually write the report. This person needs to be checked again in 6 months, or needs to be checked again with an ultrasound, or in a year. Follow up with your doctor. Many people get lost in the system because they do not follow up, and hence I say, make it a habit. Write down write down your results or ask for copies. Make it a habit. That's what most people do in this side of the world. In this side of the world, the system is so intact and organized that I have access to 1980 history of my patients because they are good with record keeping. That's another problem we have in Africa. There's poor record keeping in some hospitals. So you need to make it your responsibility to keep records of your results. keep records of your follow-ups. People get lost in the system and they blame the system. They blame the doctors that he never or she never called me back. Hello, it's your health. Make it. I teach my patients to take lead. I am coaching them with their health. I am helping them take responsibilities the responsibility of their health. It's their health. It's important that they take the lead, right? Take the lead of your health. Take the lead. Remember, I said in Canada, people are 20 years over than us in South Africa, and yet South Africa is one of the best countries with great health system. Yes, there's still things that could improve, but it's free health. That's free universal health. And of course, there's free medications. So you have no reason. You just need to wake up in the morning and go to those queues, right? I mean, anything that is free, it has its own pros and cons, right? So it's your responsibility as physicians, as nurses. All these people are here to help you, but you need to take full responsibility of your health. All right. So, and it has nothing to do with education. Here in this side of the world, people are not necessarily literate, but the system teaches them to take a responsibility of their health. It is your health. I train my patients like that. I train them to remember to take their blood pressure, to make sure that they bring it to me if they start seeing that there's a rising blood pressure. You train them. If there's any colleague here, train your patients to take lead of their medical conditions, right? Or at least to come for appointments, to come for follow-ups. All right. So that's basically what we need. And of course, we need to screen for this one. Many people, even in this side of the world, I always tell people every year, know your STI screening status, sexual transmitted infections. Don't tell me you are married. Don't tell me that you are in a stable relationship. It is important to know your status. I've seen many people crying in my office, telling me that they were married or they are married for 20 years. Boom, they have HIV. Boom, they have chlamydia. Boom, they have gonorrhea. These things happen, guys. These things happen. And I am one of those physicians that are very practical about life. I tell my patients, let's do this. And I give them that choice. And I don't force them. If people don't necessarily want that, that is okay. But me, as their caregiver, as their healthcare professional who is in their lives, I need to give them this knowledge so that they take care of it. I do it too. Does that mean that I don't trust my partner? No, but it's part of my responsibility. It's part of also his responsibility. We do it, it doesn't make us fight. Yes, so it's part of looking after your life and also your health, right? Make it a habit to do, it's your responsibility, right? Many people, I know that a lot of it has layers, more especially in our continent. People, they get married not knowing their spouse or their partner, their status. And then they start having children. And then people even are scared to test for HIV, right? And now we're starting to see all these people. South Africa is getting better because I understand people now are screened in pregnancy. There is no consent issue. People are tested so that you don't leave a child. We had seen so many orphans dying, or maybe even the parents dying unfairly, leaving these little ones with no parents because people were scared to test for HIV. Something that now is controllable. People who have HIV, they're taking their medications, like people who have diabetes, like hypertension. It's not a death sentence anymore. So it is your responsibility to test your status, to know your partner's status before you engage in sexual activities. Make it your responsibility, not the other person's responsibility, your responsibility. It is your health. You need to take care of your own health. All right. So STI screening, you ask your physician. And I know that before I left South Africa, we used to treat symptoms when they came in. But I understand things have changed. I'm not sure how things are running there. But in this side of the world, we treat people. We screen people. When they come to me for their annual examination, I offer it. Some people say no, some say yes. Most people say yes because they want to know their status. It's always not good to know where you stand in life, right? So that's very important. And while we are talking about STI screening, make it a habit when you have a boy child. This one, I really need you guys to pay attention to it. When you have a boy child, educate your boy child. When he feels pain on his scrotum, on his testicles, must report to you immediately. Because testicles, they tend to have this squeezing. Sometimes they will twist. Sometimes there's cysts there. Sometimes, like I said, they will twist. And when a testicle twists, it could die, and that could affect this little boy's manhood. Because remember, testosterone is right in those testicles, and that's part of wanting, of being a father if they plan to have children. So it's important to examine and train your children when they feel pain to report to you immediately, because we do ultrasounds to examine what's going on, why there's pain there. There's so many other things that happen there. Sometimes there's cysts that are not necessarily going to do anything to your child. Sometimes there's hydrocele, like fluid there. Sometimes it needs draining. Sometimes we leave it alone. But train your child to examine, or yourself examine your child. So it goes back to the relationship you have with your child, so that your child does not report this late. We've seen it, guys. We've seen it when kids come late to the emergency unit and their testicle is dead. It affects their self-esteem. It affects their being. It affects, some kids have even committed suicide. I mean, it's a small rate, but I want to mention these things. It does affect them. All right. So make it a habit. If you have a partner, if you yourself are not comfortable, because sometimes moms are not comfortable. I'm fortunate. I'm a physician. I have that relationship with my son. I examine every now and then. His dad checks him. So it's very important to have that relationship with your child. Ask your partner, ask your spouse to check your child. All right. Because if there's any lump, and also if your child, teach your child, if you feel any lump down there, please let me know. Some kids, they play with their penis as they grow. It's part of growth. They play with their penis, and sometimes they could have something called paraphimosis. That foreskin pulls over and it gets swollen, and it can be very painful, and your child is scared to report to you, and because he's shamed about, what will my parents say, what was I doing? But unfortunately, these things happen. And again, unfortunately, you need to understand that children, actually, they do all these things. It's just part of their growth. As they develop, children, they start exploring their sexuality. So these are the things you need to educate your children, because we do see that. Because again, some kids would need emergency circumcisions because of that, the swelling they have there. So educate your children. All right. I know it's a whole lot of things. Hence, I said, please, if you missed it in the beginning, come back and watch this. Take notes down. Go see your physician. Go see your nurse, because most people are in graves today because they never knew what they had. And it's preventable things, guys. It's preventable things. Today, no one should die of complications of hypertension. All right? Because remember, hypertension also, we see it in pregnancy. So if you had an uncontrolled hypertension even before pregnancy, that's a high risk to your unborn child, right? So it's very important. And also, when you are pregnant, make it your responsibility to come back to be checked monthly or whatever times. As you progress in your pregnancy, we start seeing you every 2 weeks or every week. So you need to check that. We also screen diabetes in pregnancy, right? So make it your responsibility to check and also follow up. Many people blame the system. You need to make it your responsibility to follow up. It's your health. All right. So you screen for all of those things. All right. And then, of course, I want to also talk about alcohol. Alcohol, guys. In Africa, South Africa specifically, where I come from, South Africa is one of the highest countries rate with the rate of consuming alcohol. So it says something about mental health in our country, unaddressed issues. Many people, they use alcohol to numb their depressive symptoms. They use alcohol to numb their past pain, their traumas. Alcohol, guys, we need to talk to your doctor about how much you can drink. There is a safety, measure in consuming alcohol. And nowadays, new studies are showing that alcohol also has a risk of developing cancers. Yes, alcohol has that. I mean, we've known it for the longest time. It could cause cancer of your liver, right? So you need to have a safety measure, how much you can consume. So talk to your doctor about that. All right. Again, for women in my country, we have switched now from 21 years to 25 years to screen for cervical cancer. We do pap smears. Normalize, if you're a sexually active woman here, And I know that for some reason, many people did pap smears and yet they were not sexually active. Pap smear is for a sexually active woman who has a penetrative sex, right? We screen for cervical cancer. And of course, we look for many things. We look for genital warts, right? Even men who sleep with men, they have risk of developing genital warts. Or even women who are sleeping with men who have also oral sex or who have anal sex, they have a risk of developing genital warts or oral cancers or cervical cancers. So screening, screening, screening. Do your pap smear. If you know you are sexually active, start screening. Again, ask your country. Where I am, we start at 25, but if women are ready, do you want to do it at 24, at 21? We do it. We never decline that. We do not push people away from doing pap smears. Okay, so pap smear is to screen for cervical cancer. And again, if you have been found to have abnormal results, abnormal smear, abnormal follow up. I had a patient who told me she was scared to follow up. That's not the reason not to come, because cervical cancer, you check it on your stats, it does kill people. It's a preventable disease. And how do people get it? From an STI, human papilloma virus. It's an STI, it's a sexually transmitted infection. And I'll tell you this, many people will actually get HPV, we call it HPV, without knowing. It's like a flu, it's like a cold. Some people will clear it, some people will unfortunately have these, the genital warts, or will have cervical cancer, or will have oral cancer. One time, 10 years ago, I had a patient who had a genital wart right in his palate, on his palate, inside his mouth. I had to refer him to an ear, nose, and throat specialist to remove that. So these things happen. People who have oral sex, you do have a risk of developing genital warts. And hence now we also encourage people to use dental dams. There's also, like we could say, these condoms of your mouth if you want to engage in oral sex. So there's so many things now to prevent people. So screening, 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 guys. Do your pap smears. In my country, we do it every 3 years, or at least you need 3 normal pap smears every year. And then afterwards, if everything is normal, we do it every 3 years. And there is a vaccine to prevent you from getting this HPV. And again, not everything is 100%. At least the efficacy, the effectiveness is around 97%, which is great. And actually, we even in schools, we give this vaccine. Some parents, they refuse this, they don't trust vaccines, but I always say, if you trusted TB vaccine or you trusted polio vaccine, why can't you not trust this one? Are you going to be there when your child starts sexual activities? Patients, they look at me in the eye, they're like, no, yes. You will never know, even yourself. It is safe up to 55 years. So if you are sexually active, do take it. It saves lives. Nowadays, we're starting to see, in my practice, I see less and less numbers of people with genital warts because people have vaccines and also people are screening, right? Nowadays, people that have genital warts, it's people that are older, in their 30s, in their 40s, because now this generation of children, it started in Australia and Europe, and then in North America, we said, wow, you guys are doing great. Let's give it. Now, even boys. I was impressed. One of my colleagues, she showed a picture of her son receiving. I was so excited to see that in South Africa, her son, who is probably in his teen years, 16, 17, who was receiving Gardasil. Gardasil 9 is a vaccine that is preventing people from getting HPV. HPV that causes cervical cancer, genital warts, oral cancers like throat cancers, anal cancers. Men, gay men or men who sleep with men have a high risk of developing genital warts around their anus or even anal cancers. So this is serious, you guys. All right? This is very important. And you will never know who has the partner you meet today. And unfortunately, with HPV, you could never say you got it from the partner you have this year. You could have had it last year from a partner you had last year or 2 years ago. That's the interesting thing about HPV. You cannot say it's the current partner who infected you, right? I mean, sometimes you can tell if you knew that all along you've never had, and then with a new partner, you could probably tell that it's a new partner you had. But most of the times, you do not know who infected you. So prevention, right, is very important, right? And then, of course, nowadays, we see young people with colon cancer. bowel cancer. So exactly, you need to start screening. There's a stool test to screen for this. We take your stool, you send it to the lab, and it checks. There's basically all these advanced tests to check for colon cancer. Or you go for colonoscopy, the scope that they put tube that has light right inside your butt to check, put a camera in there to check for polyps, like little growths that could turn into cancer or cancer itself. I'll never forget this. I had a young man who was 50. Young, 50 is young in Canada. Like I said to you, people live here into 80s, into 90s. This young man, farmer, healthy, 50 years old, did blood work. Everything was fine. Guess what happened in the examination? I did my exam. I'll never forget that experience. And actually, it has taught me not to ever forget to do rectal exam. All right. So this man, I do an examination. I come across a lump in his rectum, and I send him immediately to a surgeon. Boom, he had rectal cancer just from finger examination. So this is easy, easy peasy, less than 1 minute. I was done diagnosing rectal cancer just by going for physical examination, you guys. Normalize going for examination, head to toe. At least every 3 years, if you're a healthy guy or healthy woman, please go for it. Or at least yearly. I call in my patients whom I know they are high risk for many illnesses. I see them every year for these examinations. So it's important to know your history, your family history, and to do follow ups. All right? Screening. And of course, when we send you for blood work, we're checking your liver enzymes. We have to see how your liver is working. People, like I said, people drink a lot of alcohol. Maybe your liver enzymes are up the roof. So you need to check your liver enzymes. You need to check your kidneys, how they're doing. People have kidney failures and complications of hypertension or diabetes. It's kidneys. People have kidney failure. That's why you see people going for dialysis. Many of those people, they have diabetes. They have high blood pressure. It's called hypertension. So you want to check all that blood work, right? So that, and of course, other things, mental health. I do not let my patients leave my rooms without checking, screening for questions to check if these people are doing well mentally. We have COVID right now. People are not doing well. People lost jobs. People lost relationships. People, there's so much we're dealing with. So we need to check in and normalize mental health, guys. Mental health is part of public health. All of us. No one is immune to it, right? You could be a president, you could be any, it affects people from all socio-economic classes. So the mindset of it's for white people, I've heard many silly things people say. For as long as you have emotions, you have a heart, you have a brain, you have a mind, you feel. All right? You feel. And for as long as you experience life, life is hard. People are going through so much. People are losing their parents. Many people right now did not grieve. I went back to South Africa in November. People were telling me they lost their uncles. They are like in one family, 5 members. When did you have time to grieve? That could predispose you to depression. That could predispose you to PTSD. That could predispose you to anxiety. So you need to screen for these things. You need to go for counseling. You need to go for grief counseling. You need to go for counseling. And COVID-19 also brought a lot of emotions. People had time to sit down with themselves. So many things came up. People brought up a lot of traumas from their childhood to my practice. So these things are happening to everyone. It has no culture, it has no race, it has no socioeconomic status. We are all affected by this pandemic. All right. So speak to someone. And I know that many a times people go to their pastors, and I applaud our pastors, but they're not, most of them are not trained mental health professionals. Go see your counselor, go see your social worker, go see your psychologist, go see your doctor, go see your nurse. Please, guys, normalize going for therapy. Therapy should not be something we react to it. It's something we need to normalize it. All right? Go see. That's why you go to a dentist to do your teeth. Sometimes you don't even have a problem with your teeth, but you go for your teeth examination. Normalize going for therapy just to check in. Just to check in. It's very important, right? So that's very important to normalize going for therapy. Sometimes we give medications, sometimes people do well just in psychotherapy, right? Normalize. It's a journey. Life is hard. People went through so much in their childhood and they never dealt with those issues. Those issues are showing up in their marriages. Those issues are showing up in their parenting. Those issues are showing up in their colleagues, in their work with friends, everything. And remember, I always tell people, you did not choose your childhood. You did not choose your parents or whoever took care of you. But today it's your responsibility to undo those stories by what? By digging them, right? Dig those stories. It's your responsibility to reparent yourself now, right? It's your responsibility, right? It's very important for all of us here. Many things happened to many people, but it's your responsibility to heal, right? And I know that many people will ask, I do not have money, but many resources out in our countries are there free. Talk to someone. No one should commit suicide, guys. It breaks my heart when I see people suffering to a point of committing suicide. And again, it's a complicated situation of depression that was never treated for you to be in that dark place to consider killing yourself, right? So be there for each other. Be there for each other. Normalize these discussions. Don't shame each other. Don't shame each other. All right? Be there for each other, right? So as we close, these screenings, guys, it's something we do. And if there's any follow up, this is my closing statement. If there's any follow up indicated on your tests, please, again, it's your responsibility. Come back, right? Come back for these tests. This is how we measure, this is how we monitor progress, or this is how we start referring you, okay? These things are preventable. Most things, most of illnesses, except for the genetics, it's the environment, how we live our lives. The stress, how do you manage your stress? The obesity we see in the world, it's because a lot of times people are living under stress. It can be hard on your organs like your thyroid, right? When we are stressed, we can have all these anxieties, we can have depression, we can have racing heart, we could have like so many things with stress. You gain the weight because there's cortisol, a hormone or a chemical in your body that goes up and makes you gain weight, right? And makes you have higher risk of developing diabetes, right? So it could be something like negligible, like not managing your stress. Meditation, right? Find a place in your house, in your room of your peace, your peaceful place. Meditate. If you're in a bathroom, you are in your office, you are at work, do these meditative practices. Deep breathing. These are things that are basic, that are important. They sound easy, but they are tough. A lot of people, they forget about it. I sometimes forget when I have a busy life, but I stop sometimes and stop myself and take deep breaths. When you take deep breathing, it circulates that oxygen to all the parts of your body, right? Mind the people you keep in your circles, right? Mind your circle. When people are toxic in your space, remove yourself from such circles because toxicity, it basically rubs off. You start becoming negative in the way you look at life, in the way you see yourself, in the way you look at basically the overall life, right? So guard your mental health. I emphasize this all the time. Watch your mental health. Watch your mental health, right? And again, remember, watch your blood pressure, know your HIV status, know your STI screenings, check your breasts, right? There's examinations for that. Screen for colon cancer when you reach age 50 and above or earlier if there's any family history, or if you are an obese person, unfortunately, it has a risk of developing colon cancer. You might need to screen early in your 40s. Again, it depends on your resources, guys. I'm not putting pressure on you, but these are the things you need to discuss with your physician or your nurse practitioner or your nurse in your clinics. So these are the things that are accessible. Many illnesses could be prevented if we screened early. Many people here, they live longer because we screen them early. So sometimes it breaks my heart because in South Africa, we have free hospitals with free health services. And of course, I know people will come back to me and say, oh, dog, it takes forever. But unfortunately, everything that is free, guys, it takes forever. It's your responsibility to show up. It is your responsibility. If you have a medical aid, to me, it doesn't make sense that the next year you still have funds, you have not done screening. That breaks my heart. You have not gone to a psychotherapist to go check in. I love people like Unati, like your celebrities you love and look up to. That girl, she goes for therapy just She doesn't have crisis. She just goes for therapy. That's important. I check in too. I have my own therapist that I speak to because I deal with a lot of things. It's hard to deal with emotions, with other people's emotions, while I also deal with my own life. So I do see my own coaches. I do see my own therapists. I have my corner where I have my sisterhood that supports me, right? So have that for yourself. Have that for your brotherhood. Have that brotherhood where you could have your vetting spaces, right, guys? So as we close, I just want to let you know this: these things are preventable, except I always say it's our responsibility to switch off our genetics. We cannot choose our genes, that we can't change, but we can change how we move forward. How do we move forward? We switch off those genes. How do we do it? We look at our lifestyles, lifestyle modification. Most illnesses, most diseases we see, it's mostly environmental. It's the way we live, the stress people have. It reduces or it depletes your immune system. And then you have all these risks. You develop these cancers, you develop all these, you have overweight, you have obesity, you have diabetes, you have, these are all these risks that will unfortunately lead to other complications I've mentioned, right? So as we close, I just want to honor you for being here with me, and I hope you took notes, and I'm hoping you take action, right? Remember, I said in Canada, people here live into their 80s, into their 90s. People here, they even live alone. The system is that supportive that they even live alone in their homes. They're in their 90s, they are healthy, they come. Some people are still driving. you know it's beautiful to watch. But I'm not saying that's practical for other countries. Fortunately, most of people back home, they walk. That's part of exercise. you know Exercise is not about going to the gym and running. It's about just walking around the block in your office at your lunchtime. Take your friend, grab a friend who is into lifestyle modification, and it becomes a journey. It becomes your lifestyle. I know a lot of people, they go on all these diets that are not sustainable. Make it your habit. Make it your everyday life, right? Make it, watch your salt intake, because when you eat lots of salt, it increases your blood pressure. So watch those things, right? Watch your diet. What do you like sweet things? All these things, they do increase your risk of gaining weight, and also your dental care. We have people that have never gone to a dentist to check their teeth, and they eat ugly foods. They eat lots of sugars. They eat, all these things. So it's important to take care of your systems, your bodies. Life, it could be that simple. In the olden days, our ancestors, they didn't necessarily have access to hospitals, but they took care of themselves by eating organic, right? Normalize. I'm starting to see many young people that are farmers. It's beautiful. People are eating fresh produce now, right from the ground, right? Because those are all antioxidants. The life we live, it's so stressful. We need to eat all this fresh produce, right? Those are antioxidants that help us have tissues that are healthy in our bodies to reduce chances of developing all these illnesses. Normalize drinking water. A lot of people, they drink only pop. People like their cokes, they like the energy drinks, guys. People love energy drinks. Energy drinks have been associated with heart issues. Watch how much you consume with those things, right? Drink water. If you have a heart disease, talk to your doctor, talk to your specialist, your heart disease. Usually, I mean, your heart specialist. Usually, we don't recommend anything above 1 liter a day. But if you're a healthy person, 1 to 2 liters a day is fair enough. Drink water, normalize. Sometimes I forget to even buy juice in my house. I have to think when I'm going to have friends coming over, because we love drinking water. Drink your water. It's good for your skin. It's good for your being. Sometimes you're not hungry. You're just thirsty. Because a lot of times people eat because they are thirsty. If you had to drink and normalize drinking your water, you would not eat so much, right? So sometimes there's all of that. If we normalized drinking water, simple. Drink water every day. 8 glasses of water starting. Start there. 8 glasses of water. South Africa has one of the best. What I always say, Canada, you guys, you don't know how much I miss drinking our tap water from South Africa. We have beautiful water there. So drink your water, right? Less of the pop. That's very important, because pop is sugar. It will cause you to gain weight. It makes you gain weight, right? And sugars, they turn into fat. So are the fats turn into sugars in your body. So these things, guys, they're all related. So we could do things to prevent them. So again, and as I close, thanks for being with me. Go back and look at your life. How can you help your uncle, your mom, your dad? Because we come to you in front of these screens to educate you, for you guys to go speak to your relatives back home. So this is for you, our mouthpiece. So you go to the world and change the world. All right? Change the world. We could be a better place if we did little. The little you can do in your corner, it will change the world. All right? So as we close, come back again here. We're coming back again next week. I bring speakers here. If I don't have a speaker, I come here and just come and chat with you. I know that you guys might have a lot of questions. And as I close, I know people always say, Doc, how can I see you? I am unable to see anyone outside my spectrum, my radar. I'm in North America. I can only see my patients. So you speak to your doctor, you speak to your nurse, you speak to your nurse practitioner. I'm unable to do that because of medical legal reasons. But for coaching, yes, we can do that privately. But things medical, you need to speak to your health professionals. Okay, again, as we close, take care. I love you all. Come back same time. It's 11 a.m. MST, 13 hours Eastern Standard Time. We come here every week, 7 p.m. South African CAT time. Come back here, share the page, share with your EAP. I forgot to mention that. Talk to your companies. If they don't have employee assistance programs, challenge them to have, because you guys, you could even have a gym in your workplace, or the little I mentioned, take a walk around the block at your lunchtime, grab a friend, talk positive stuff, right? Go to the nature, right? So there's so much we can do to help our mental health and also our well-being by doing the best we can in our corners. Again, take care. I love you all. See you next week.